Um, all right. So, uh, first of all, thank you for coming out. I know it's kind of like I'm certainly on the East Coast here. It's a little sort of late this evening on a Friday. And so I appreciate you taking the time to jump on. Um, these sessions, typically the way I like to handle them, I kind of go through sort of a presentation, some of the general information about the product, kind of recap some of the key points about the product itself and about its use. And then we'll go through sort of more specifically in a kind of a step-by-step way, the standard application, the topical application protocol. I have my model here that I use, my favorite model, and she's always very patient and and complies as we move through the process. But it gives me an opportunity to kind of show you in a way, in a more specific way, about how you're putting down product, what the resting times, what you're going for in terms of the how the product feels and behaves, and kind of walk through that process. So we'll do that, and then any questions that you have, sort of after the fact. I mean, you can pop them in the chat. You can, potentially even just, put them in the chat as we're moving through. We're not a huge group here tonight, so I think we can probably get away with taking some questions as we go. But in any case, typically I'll try to get, kind of this product information, standard protocol application, and then any questions really after that. So I think without sort of further ado, maybe what I'll do here is get this started big so we can see, and then I'll share the screen. And I don't know if any of you been on any of these kinds of trainings before. Laziza, maybe you were on the other night with Mona, so you might have seen some of this here. But in any case, that being said, basically what we have, obviously, we're here talking because you're aware of our BioRePeel product. We have the two formulations, the blue and the gold. The blue is the face, neck, and décolleté formulation, and really the kind of three pillars of our position in the marketplace. I mean, have really been driven by the no peeling, no pain, and no downtime. Aspects of how the product behaves when it's applied to a patient's skin. And so, certainly from an expectations point of view, both for yourself and for your patients, during the procedure, there shouldn't be any like excessive, kind of pain. Normally, if I ask, a patient or somebody in a demo or anything, like where are they on a 1 to 10? They're like a 1, 2. Maybe if you dermal before, or you're doing some surface needling or something, that maybe they're like a 3, 4, or something like that. But I mean, I've never been involved in I've literally never been involved in a BioRePeel session that involved like fans and and people talking about spiciness and things like this. So as a kind of a general matter, this should be a relatively painless procedure. The no peeling, the no downtime. These are really the really what I think separates our TCA from really any of the other kind of true sort of medium depth TCA products that are on the market. People are going to be able to use this product. They're not going to have the excessive peeling. They're not going to have the downtime. They're not going to have the photosensitivity, and they're going to be able to kind of have the peel and move on with their lives and be sort of back to the routine in the days following, as opposed to kind of hiding away in the house. But trichloroacetic acid is your primary active ingredient. The product is suitable for all Fitzpatrick's. It's suitable for various skin conditions, if it's hyperpigmentation or melasma or acne or scarring or rosacea, lines and wrinkles. Really a whole host of skin conditions, and again can be offered all year round. So peel season are two words that you're not going to be saying anymore with this product. Um, the uh, the peel is applied as a general matter. Standard application is going to just be topical. You're gonna apply it to the skin. You're going to use just a very light pressure to kind of massage the ingredients together and activate the ingredients. This is not one of these deals where it's like, you must use 5 pounds of pressure in order to work the TCA into the skin, into the pores. You're not doing any of that. The isopropyl myristate is gonna act to deliver to accelerate the absorption of the TCA, to deliver the TCA, through the epidermis down towards the dermis. You don't have to manually stimulate that action. Really, when you're doing that massaging, you're just doing it to combine the ingredients and get them activated. But there's not, it's not going to be some prescribed pressure in order to try to work this into the skin. Um, the peel is multifunctional. You can use it together with various different modalities for skin preconditioning, as well as post treatment, and we'll talk about that a little bit further in a minute. But in any case, it can be used to get just as a standard standalone topical application by itself, or can also be used together with other modalities for kind of stacked type of treatment protocols. And the reality of the situation is that there should be an expectation of immediate results with this product. So even from the first time out, you could be doing a 4 session series for somebody. After the first peel, they're going to see, tightening of the skin and firming and toning and glow and things like this. And some, if it's acne, that the pustules are going to dry up and go away. The skin is going to calm down. There's going to be some of that that's going to be immediate, and then there's also going to be some results that are going to be cumulative over the 4 session series, or whatever you're going to be applying to the particular patient's condition. The this kind of recommended protocol, again, if somebody comes in and they just want to get freshened up and rejuvenation and this and that, that's a one-off situation. If somebody has a particular concern, a particular skin condition that you're going after, you're going to want to be doing that in a series. And the typical, the recommended series is going to be a series of 4. Those peels are going to be performed 7 to 10 days apart. And so effectively, you're going to be doing a four treatment series over the course of like 30 to 40 calendar days. Okay. And so it's going to be in a short period of time. You're going to be providing, treatments on Monday, the following Tuesday, the Wednesday after that, right, or whatever, and really, kind of stacking this over a short period of time. And it's going to allow you to, see your revenue on this, and from a business perspective, and have that, that treatment series kind of start and wrap up relatively quickly. But then from the other side, you're also going to be delivering results very quickly. And that's really the key, is that, again, with a lot of other products, it's like you do one and then you got to wait, a month or two between the downtime and the healing and the rest of it. You're not even talking to somebody for a month, and here you're going to be like finished your series in a month. So, so it's very, kind of positive in that way. 7 days, let's say, on the low end. And then, the 10 days they're talking about, like if you do some advanced protocols, like, combining the gold together with the blue. We have different protocols for that, for melasma, and like for acne clustering and things, where you would put the blue on the face, and then you could use the gold product to do spot treatment, and touch on those areas that you want to get really a deep penetration without using that on the whole face. So there are some, those kind of advanced protocol, or I don't know, maybe if you do dermal planing before or something like that, you want to have a little bit of a larger window to give more healing time for the skin in between the treatments. The gold peel, which I just was touching on. So this peel, the face, neck, and décolleté formulation, 30% TCA. The gold formulation is a 50% TCA. So it's significantly higher, in terms of the TCA content. But all of the other ingredients in the formulation really remain the same. So, the arginine modulating ingredient, the squalane, the gamma, the vitamin B, the different amino acids, and all of that stuff, that all really remains the same in terms of formulation. And as a result, in terms of the way it behaves and interacts with the skin. But from the other side, you have that higher concentration of TCA, so you're in a position to get this kind of deeper penetration and the stronger result. Particularly on the thicker, kind of more resilient skin of the body, but again, also when using it as a spot treatment for, particular, if you got some particularly dark pigmentation or whatever that you want to go after on the face or the neck and décolleté. So, so that product is going to be is going to kind of pull double duty as a body product as well as a spot treatment product. The gold again is going to be, massaged lightly into the area of application. There's not anything specifically different in terms of the application protocol for this product. And similarly can also be used as a standalone, or maybe you're going to do together with some other type of modality based on what specific concern you're trying to address with the use of the products. Um, Immediate results as well is going to, there should be an expectation that you're going to see some immediate result after the first treatment, but then also as you go through a treatment series, you're going to see that continued sort of cumulative effect and that stacked effect that that the results will become significantly more visible and more obvious as you move through that treatment series. Um, Here as well, you're going to be doing, kind of 4 to 6. The peels can be performed slightly larger window, 10 to 12 days apart, which really is just because of the higher TCA content. You want to have a little bit more healing time for the skin between peels, but you still want to keep them relatively close together, so that you can try to maximize the benefit of that cumulative effect of having them in close sequence or close succession to each other. um, 10 days on the lower end, 12 days if you were doing some kind of advanced protocol, some, mechanical injury component or something before you were doing the peel. The underlying science, let's say, behind, what that kind of drives this product is really, again, it ultimately boils down to, people ask me all the time, well, why is this behaves different than another peel? Why it's better than, whatever other peel, the VI peel, or it doesn't make their skin shed or whatever. And the answer is always formulation for me, right? And it really comes down to the science of it. And the chemists that invented this product, it wasn't by accident. They didn't stumble onto this and say, oh, look what we have here. They purposely set out to develop a product that kind of checked the boxes, in regard to what like patient demand was dictating, right? So, you had these other peels on the market and they're all nice and good and they do the job and, clinical results and all the rest of it. But, the downside was, I got all this downtime. It's so hot when we're doing the treatment. We have all this excessive peeling, et cetera, et cetera. And so there's a whole host of people that are using those products that don't love the price they have to pay for that after the fact. And then you also have the other side of people who would never even go near those products because of those things and couldn't like not even can't imagine to spend the time, but like don't have the time to spend, take 3 days off work to be in the house because they have all the downtime and they've got all this peeling and whatever. So, there was a market segment that wasn't being addressed, and there was a market segment that while they were being addressed, they weren't loving it. And so they set out specifically to develop a product that would behave in this way, that you could have that medium depth, chemical injury, that medium depth action, that peel, but without all of the kind of negatives that came along. And so this, the what they call the biphasic technology, which I think must be some sort of like translation from Italian. I don't know what biphasic means in English specifically, but this biphasic technology basically is, like looks at the separation between the different types of ingredients. And so we have the lipophilic phase and we have the hydrophilic phase. And the lipophilic phase ingredients are like those that that prevent the transepidermic water evaporation, the moisturizing ingredients, the hydrating ingredients, those modulating ingredients, etc. But interestingly enough, what happens with those ingredients as well, and if I just grab the box here, but what happens with those ingredients as well is from a sort of a shelf life and a storage perspective. They also, and I mean, you can see it in the bottle here. You have this dark blue and the yellow underneath, and that dark blue layer that sits on top, it actually prevents the oxidization of the acidic, hydrophilic ingredients in the bottle. And so even after the bottle is open, um, the oxidization process is retarded, and so for 6 or 8 weeks these bottles can sit after the membrane has been pierced and there's air inside and whatever that would normally kind of cause the acidic ingredients to oxidize and spoil very quickly. These products are going to be good sitting on a shelf in room temperature for 6 to 8 weeks after the vial has been opened. And so again, in other situations, you got products you have to keep them in the fridge or whatever because you're trying to retard that oxidization process and the breakdown of the ingredients, where the lipophilic phase or the lipophilic ingredients here naturally rise up and sit on top of the hydrophilic ingredients and cause this barrier to prevent oxidization. The yellow ingredients, the hydrophilic ingredients, those are those that are going to be like really where all your acids are, right? So you're going to have those are the ingredients that are going to stimulate the fibroblast activity. They're going to increase the cellular turnover, push forward the generation or the production of the collagen and elastin. So the tightening, the firming, the toning, the cleaning up of the skin, that's all really driven by your hydrophilic ingredients. This is always a big one, right? So contraindications. Really, the majority of the stuff on here is like, I mean, this is common sense stuff. They got open wounds on the face. You're not doing a peel. You have some inflammatory dermatosis, okay, or something like this. You're probably not going to be wanting to do chemical peels on them. Pregnant, breastfeeding, so on and so forth. Okay, so this stuff that's kind of, again, that's sort of common sense stuff. For me, the real call outs are the retinol, retinoids, the actives, and the Accutane. Okay, those are the ones to me that are like the things that are going to come up and that are going to be the most maybe the most important, just in terms of setting the right expectations with patients. Okay, so if they're using like these creams and the retinoids and it's got the actives in it and so on and so forth, they want to be stopping using those products at least a week before they're going to come to start to have a BioRePeel. If it's like a one-off BioRePeel, they're going to stop a week before. They can pick up using those things maybe 5 days to a week afterwards. Okay. If you're doing a series for somebody, they're going to stop a week before, then they're going to have their first peel in the series, but the next peel in the series is coming a week later. So they're not going to have an opportunity to pick back up using those products really until you've finished out that series. And then you wait on the back end of it, because they're going to be happening every week. They're never going to have a week in between, to start to use that again until after they finish that series. So, so the retinoids, the actives, you want to make sure that they stop, kind of well enough before and don't pick up until after. Nobody is going to have like a heart attack and die on you because they're using the retinoids or the retinol cream, and then they come and they get a BioRePeel, but they are going to have flaking of their skin, and there's going to be some peeling involved potentially. If they're still have those things in their system. So, the kind of further in advance they can stop, the better. But again, as long as you're setting the expectation, like that this is the no peel, but if you're using the retinol 3 days before you walk in the door here, like there's a strong likelihood you're going to get some peeling. Then people just need to be prepared for that is all. Or you need to be prepared for that at the very least, so that if somebody comes to you and says, well, look what's going on here, you'd say, well, what creams are you using in the night? And does it have this ingredients or those actives or whatever? And 9 times out of 10, you're going to get to the bottom of it real quick. If you see that kind of a reaction, it's almost always going to be because there's either retinol or some actives in a product that they're using with frequency that they may or may not even realize have those things in them necessarily. The Accutane, you want to stop like really way before. The real truth is, if you can get in front of the Accutane use and use this product for going after acne, the results from everything I've come to understand about acne treatment with BioRePeel are absolutely fantastic. Okay, and so any opportunity that you have to come, have somebody come and they've got this acne and you want to try to address it, like that's that's going to be a good opportunity to get in front of the Accutane use and to try to use this product to treat for those conditions, because it's really, really strong. If you give me 1 second, I have a picture here. I got a picture here. Let me see if I can stop sharing for 1 second. And I'm going to find this really quickly just to show you somebody. And I've included it in some emails I've probably sent you guys, but I kind of always refer back to this. This client actually is a client of ours, and so she picked up the product and she started to do a series on herself. Okay, so this was June 29th, right? And this is like the kind of acne that she had going on June 29th, right? And July 17, so the third treatment later, this was already where her skin is at. And this to me is life-changing stuff. This is not like a small thing that you can have this kind of an acne situation prevalent live all over the place, texturized, like the skin is red, it's inflamed. It's I mean this is everything that acne can be in that sense. And to be here 3 sessions later, over the course of just a few weeks, right, is to me, I mean, some of the most impressive results I've seen. And like, is that going to be that everybody is going to have this situation? Absolutely not. I mean, I'd be lying to you if I told you that, right? But at the same time, if it can perform like this for somebody, it can perform like this for other people. And so again, to get in front of Accutane use and some of this other stuff and try to, to get at a treatment series or a kind of a two treatment series. You do 4 treatments, you take a few weeks off, you do another 4 treatments. You're going to be able to deliver strong results for people with acne conditions. Um, and but without I mean, without going to that to that level, and with using a product that's not going to have lots of downtime and that's going to be not photosensitive and that's going to work for their skin type, etc. So so again, so to me, for acne use, this product is really strong and something that that you should be considering, as to use before any of these other products if you can. Um, as far as different modalities go, so we touched on it earlier, but basically it's like, your standard application protocol. You're going to start with your Forever Kit. You're going to do your preconditioning and whatever, your skin cleaning and degreasing and so forth. You're going to do your peel, and then you're going to finish with your, hydrating serum and your firming cream. That's going to be your standard application protocol, bioretherapy system using our product set, and you're going to do it that way. And 7 out of 10 people that walk through the door, that's what you're going to do for them. Um, you can dermal plane before, you can do microdermabrasion before, you can do hydrofacials before, you can microneedle this product onto the skin. You can microneedle before you put the BioRePeel. It's going to be spicy. You can do it. You can do the BioRePeel and microneedle after you're going to do it. So you're going to be able to combine the peel with those kind of mechanical injury systems, generally speaking, before the peel. And then after you've done the peel, you can do, the hyaluronic mask or the LED therapy or some, do the extractions or whatever. You can do injectables. If you've got patients come in that are getting, filler or something like that, do the peel, do the filler. Not to put the filler and then start massaging and doing the peel, right? So, but can be done in the same sitting. If you're going to do injectables before, you want to have maybe like a week or two, even up to 2 weeks before you would do a BioRePeel following like filler injections. But if you're going to do the injectables already and they want to do the peel, do the injections, and send them on their way. So you certainly don't have to be scared to use this product together with these other systems. And on the contrary, it's going to enhance the results a lot, to use some of these different preconditioning methodologies, and then also, some of these post-care treatments that you might do for more kind of rejuvenation and so forth. The last, well, yeah, so basically, we're going to kind of be getting into this in more detail, but effectively, your treatment protocol is kind of broken down into these 3 phases, right? So you have your cleansing, your skin prep, you have your peel, and then you have your post, right? And so, with that, you want to be cleansing the skin, you want to be, degreasing, you want to be opening the pores, activating the skin, getting it ready to, to really accept the peel. You want to do your peel application. You wait the time, you leave it for the prescribed waiting time, et cetera, to absorb into the skin. You clean it off, and then you're going to do your post care, which again is going to be this, the hydrating serum, the firming cream, and some SPF. And so, as much as there's kind of 7 steps here, the reality is that I always view it as kind of 3 segments in the treatment in the session. Um, so starting with the prep, moving to the peel, and then finishing with the post. Um, the last slide here just really kind of touches on the financial aspect of it, but I get asked this question all the time from people about, what should I be charging for the peel, et cetera. So, um, you know, recommendation, and like, I mean, I could pull a name out of the hat in pretty well any market in the country, and they're charging 250 per peel for a 4 peel series, $1,000. um as a standalone, it might be more like 275, 300. And as a combo therapy, it gets a little muddy, right? Because if you do like, well, microneedling with the peel and it's $350, we don't know what part of that $350 belongs to what, right? But or hydrofacial together with the peel, it's going to be $400 or something like this. So so the actual resale price of the peel in that sense kind of gets lost in the broader price of the combo therapy. But even still, what you're typically going to end up with is, and certainly the way I view it is, you have a cost per milliliter and you have a sale per milliliter. Okay. And so your cost per milliliter is going to be basically fixed. You buy a box of blue peel, you have 30 milliliters of product inside. It costs you $499. Your price per milliliter is $16.50. Then it starts to become a question of how much of it are you using and what are you charging for that. So, typical face treatment, it's going to be like 1.5 milliliters, something like that. So, you're going to get roughly 4 treatments per vial, but the point is anyways that your cost on that is like 21, $22, something to that effect, okay? Um, Even you layer the cost of the pre-treatment product that preconditioning product that you're going to use, and the one pump of the rehydra and the relift, and you put it all together, maybe your cost is $30 for that session. You're going to be charging 250. Okay, so you can kind of weigh your cost, but the idea is that if you view your cost on a per milliliter basis, you say $16.50 per milliliter, you want to be charging $200. I'm sorry, or like $100 to $125 per milliliter on the on the retail end. The other thing to keep in mind is that, from the time the person sits down in the chair and you start with the preconditioning until the time they leave, the standard application like that we're going to go through today, it's not going to be more than 30 minutes in the chair. So, that time plus your material costs, right? And you kind of understand where you're at in terms of your margins on this. But again, per milliliter at 1650, you charge 100, 125 a milliliter. You're going to be sort of right there at that 250 price point, and really in line with what everybody else is charging in the market. For the body product, again, per milliliter price, 15.25, just based on the packaging and the cost relative to the packaging format, but 15.25 a milliliter. Again, our recommendation is typically between 100 and 125 a milliliter. And when I get the question about, well, how much of that do I need for a treatment? The answer really is it depends on what you're treating. So, like if I'm trying to do the elbows, maybe I need like 1 milliliter, for that area, right? If you're trying to treat acne, all up on the back, it becomes a question of the amount of surface area that you're going to be covering in that session. And over time you'll get a better feel for what you need, but as a general sort of a rule of thumb, we always tell that, like, if you hold your hand up out in front of your face like this with your fingers kind of spread open, that amount of surface area should be about 1 milliliter, 1.25 milliliters. Okay, and so if you think about it the same way, like if you put it on your face, you need about a liter, 1.5 milliliters or so for the face. It's about the same area as me putting my hand out in front of my face with my fingers open. So, that is a general rule. If you're going to be doing somebody's back, if you're doing like this and you say, okay, so that's like 2.5 milliliters then, right? Because it'll be 2 hands plus a little bit. So that guide will give you a general idea of what you're going to need for different surface areas. And then, as I say, as you do more of those treatments, you'll become more familiar with, approximately what you're going to need. And so you can just turn around to the customer and say, look, we're going to need 2 milliliters here. It's going to be $200. It's going to be 250, or whatever the price that you set up. Okay, and so with that in mind, maybe just before I move on, does anybody have any questions about any of that? Checking the chat here. No? Okay. Everybody's on mute, so I don't know if you're talking or not, but otherwise
Hold on,
we'll
Aaron,
yeah.
quickly.
Yeah.
I thought that the blue peel was 35% TCA. Is
So
it 30 or 35?
it's 30%. And the blue peel used to be 35, actually. When it was originally formulated, it was 35, and it was modulated like with a certain amount of arginine to modulate the product. So if you put a raw 35% TCA on somebody, they'll be on fire. So the 35% was always modulated. We ran into very early on, like, a lot of questions coming out of different states and stuff like that about regulations around the volume of the TCA relative to like licensing and regulations, right? And so sometime back, actually, they had changed the formulation to 30% and reduced, but basically adjusted the amount of the modulating ingredients. And then we're running tests on this for like 6, 8 months in international markets to determine if there was any impact on performance, right? Long before we ever brought that here. And so after all of that testing and like whatever, the determination was that there's no impact on performance. Everything is working the same. You still get the same penetration. You still get the same depth of the TCA penetration to the dermis. You have the same results on the underlying conditions, and they moved to the 30%, and started using that as the standard. So actually, it's 30%,
Okay,
in the
quickly.
current formulation. Yeah.
I think this morning I was looking at the files that you've sent, the dry files,
Yeah.
and it was comparing it to PRX T33, and PRX T33 said 33, and in that file, I still think, if I can remember, it says that this peel
Mm-hmm.
that we're talking about is actually 35 versus 33 PRX.
Okay.
If I'm mistaking this, I'm sorry, but that's what I remember from this morning. I was like, oh, this is 35, and this one and PRX is
Yeah,
33.
and you know what, and it may be like it may be like the old
Old file.
comparison document that lingered in there, yes, but yeah, and again, originally it was, but like I say, they changed the formulation some time back, and it's not, and to the point, there wasn't any impact on the performance of it. It's still doing the same thing. It's still, with the, without the peeling, without the downtime, but with that medium depth penetration. And so that's just, but yeah, that may have been like, I know which document you're talking about, and it was like a kind of a comparison chart between the two products. So I think that may have just been an old document with the old information on it. But all of the current documentation and like the IFU that's in the box and stuff like that should all show the 30%. Okay, so I'm going to get to application. Okay, and so again, what we're talking about today is the standard application protocol. So standard application protocol is going to start um, with your Forever Kit. The Forever Kit has inside of it really kind of two, let's say, active ingredients, I guess, as it were, and your activator spray. Okay. The first thing that you're going to be doing is going to be the microdermabrasion gel is going to be the lipogel. The lipogel is going to basically pull kind of double duty. It's going to do some, kind of light cleansing of the skin, and it's also going to lightly exfoliate any sort of dead skin cells and things like that that are going to be on the surface of the skin. It has like some microsilica beads inside of the formulation, and if you take some out and you kind of rub it around in your fingers, you're going to feel that. But then the rest of this is like seed oils and and different these kind of different ingredients that just gonna kind of generally clean up the skin. So the initial kind of application of this, what you're going to be doing is you're going to want to apply to the skin. So for me, I always shake it up a little bit just to kind of make sure it's constituted nicely. You're going to open up, and then you can apply directly to the skin. You can put some on the hand and take it off and apply. But what you're doing with this, the first pass is just application. Okay, so you put it on the skin, you kind of spread it around a little bit. You put some on the next part, you spread it around a little bit. You put a little bit more, you spread it around. Again, you can put it into your fingers so that you have a little more control over it. But all you're doing is just applying. You're not going to start with like actually rubbing it in or really working it around. You just want to get it applied over the area that you're going to be working on. Um, you're going to take your activator spray. You're going to spray on that area that you've applied this product to, and then you're going to go to get to really kind of working it in. Okay. And when you do that, after the activator spray is sprayed on, you're going to see that as you work it around, you're going to see like it's going to foam up in certain areas. There's more oils there, or there's more bacteria there, especially like in the sides of the nose and in the fold of the chin and stuff like that. But you're really going to kind of massage it in and work it in to get that good exfoliation and to get a good cleansing of the skin and like in the pores a little bit and clean it up. Um, after you've kind of worked your way around that whole area, you can just take a wet, damp gauze or a damp sponge or whatever to clean the product off, and then pat the skin dry all on those areas that you've applied it to. Okay, so this one is going to be like, first of all, application, spray with the activator, and then do your kind of real work before you clean it off. Once you've kind of done that, you've pat dried the skin. Now you're going to go to the carbon mask. Okay, and so the salicylic mask, same story. I like to just kind of shake it up, make sure it's constituted nicely. This one, the same deal. You can put some on the hands, spread it onto the area. You can lay down a little bit and spread it on, whatever you're kind of comfortable with there. But it's the same story, is that you want to kind of put some on an area, put some on the next area, put some on the next area, work your way around the whole surface that you're going to be doing the peel on, and make sure that you've got it kind of evenly spread out, and nicely applied to the skin in that area. This is not going to be like a thick, like some kind of like peel off mask or something like that. It's going to be a thin coating that you're going to apply. It's going to be translucent. It's going to be dark. It's going to be clear, obvious that it's there, but it's not going to be some kind of a thick mask or something like that. It's just going to be a good sort of even coating on the skin in that area. This one you're going to leave now for 5 minutes. Okay, so you want to start a clock, a time, a stopwatch or whatever. You're going to leave that for 5 minutes and let it sort of dry up and set on the skin. Okay. After the 5 minutes, you're going to spray with the activator spray. And the activator spray is basically just going to like reanimate the product that you've put down. So when you put it down, it's wet. It's going to dry over that time. You're going to reanimate it with the spray. And then basically once you're done spraying, 10 seconds, you're going to be able to peel it off with your fingers. And it's just going to kind of come off in like little rolls with the fingers. So you'll be able to peel that right up off the skin, with this kind of an action, and you'll see that it's going to come off real nice. And I mean, anything that gets left behind, anyways, you're going to wipe this up again, just with a damp gauze or a damp sponge or whatever, only with water. There's no like neutralizing or something like that that's required, but you should be able to peel it off really pretty well with the fingers, and then again just wipe up the area with the clean up the area with the water, and then pat dry when you're finished cleaning up, so that the skin is going to be dry. So really those are your two preconditioning steps. That process shouldn't be more than 10-12 minutes, okay, by the time you're done. The first step, you're going to be working it in, you're going to be doing all that. It's going to be maybe like 5 minutes or so. You're going to apply the mask. It's going to be another 5 minutes or so. It's a couple minutes of application. So you should be about, 12 minutes or something like that through that first cleansing skin prep phase. Okay. Um, then you're going to move on to the peel. Okay. And so with the peel, the bottles, when you get them, they have like a little blue tab on the top. Okay. And so that tab, you're going to be able to just like peel back with your finger, or like some people use like a tweezers or something, and they pull the little tab off. And then that will expose this like kind of, this gray sort of foam membrane that's here in the top. You have a question, Laziza? Just maybe before I go ahead.
Yes. Yeah, just before you go ahead.
Mhm.
So, oh my God. Sorry. I got so nervous before I
Yeah.
asked the question that I completely forgot. Just
Yeah.
one moment. One moment. Sorry. I'm
You
really
froze.
sorry.
No problem.
Yeah.
Okay, well, maybe I'll
Oh,
maybe
yes,
I'll
yes,
go.
yes. Sorry.
There you go.
Do you
Yep.
recommend really degreasing the skin even after the salicylic mask, after the carbon mask? If yes, alcohol or acetone, like what's the best?
If if you need to still, alcohol wipes. But as a general matter, between the lipogel and the mask, and after you've cleaned everything off, you should be pretty well ready to go at that point. Right. So, so typically you won't have to do more. And I mean, unless they're like coming in with like a full face of makeup or something, like, I don't know, those two steps are typically going to do it, as far as skin prep. And the degreasing and to remove the oils from the skin, and open the pores to get ready, like those two steps are, I mean, certainly in my experience, are going to be more than sufficient to have the skin ready for the peel. um, so you have your membrane. Okay. And again, when we discussed about how the product starts in that state, right, where it's the blue on top and the yellow on the bottom. And what you want it to be when you use the product, you want to shake it up. Okay. And so you're going to shake it, not like crazy aggressive, but like relatively, with some purpose, for about 3 seconds. And then you're going to see that it's going to turn this thick kind of green looking color, right? And that thick green looking color, it's the actually the ingredients are not like, this is not causing some kind of homogeneous mixture or
Oh, yes.
whatever. They're really just sort of combining with each other, settling together. And so the blue and the yellow appear to your eye as green because they're kind of mixed, but they're not actually really mixing together in that way. They're not combining fully, but they come, it comes to look to the eye like this green color. Um, an important step is always just to make sure that, when you're first going in, I like to just take one of these like little cannulas and just put it in just to aspirate the bottle, because, and particularly the first time you open a new one, there can be some air built up in there from like in the shipping, or from the manufacturing process or whatever. And then you're going to go and you're going to shake the bottle, and it's going to cause more air pressure inside. And so you want to just make sure that you go in one time, to aspirate the bottle, let any air come out of there before you go to try to draw product out. But once you've done that, you're basically just going to tip it upside down. You're going to pop your syringe in, and again, that thick green color, and you're just going to draw product out, right? And it should come out real nice into the syringe. You're doing a face treatment. Maybe you're going to take 1.5 milliliters out, okay, and then pull out from the bottle. So you'll have your 1.5 in the syringe. It's going to be that nice green color, and it's going to be basically ready to go. I'm just going to put a glove on here so I don't give appeal to my hand when I'm doing this. Um, and so as far as application, I mean, most of you have probably watched these videos, right? Where, you see that they take the product and they're making like the nice dots on the skin, right? And they're doing like this, and you get this series of the dots. And I get asked all the time, like the question, why do we do the dots? Like what's the deal with the dots? Actually, the dots, like, they look really cool in the videos that you're going to want to make for yourself, the promo stuff and whatever, but it's not like there's some science behind that. Okay, you really, why you putting down the dots is to control the volume of product that you're putting on any particular area. Okay, that's the real truth of it. Um, if you just want to like lay down stripes on the head, on the area, or you want to put a bunch in the middle and working around, the truth is you could do that. These little dots are nice. They look cool. It's controlled. They're not leaking or running anywhere, right? And so you get and you can put down an area, work
That's
on that
good.
area, and then move on to something else. And so that's going to be precisely what you want to do is you want to lay it down. You want to start to massage the
What?
product around, okay, on that area that you put the product on, and do so until it's going to become sticky, okay? And like kind of tacky under the fingers. So right now it's still very wet under my fingers. And so I would kind of, keep massaging, the product into this area. Again, I'm not pushing hard. I'm not trying to get deep in the skin or something. I'm just really only trying to combine and mix the ingredients. But as you do that, you probably can't hear it, but it starts to get, sort of sticky and tacky under the fingers. Once you feel that stickiness, once you feel that tackiness, that's when you're going to start your clock, right? And so your 7 minutes or whatever it is that you're going to that you're going to leave the product on for, that's going to begin when that first area of application becomes tacky. Okay, so now I feel that stickiness. Now I'm going to start my 7-minute timer. Then it's like, turn the head. We're going to apply some on the cheeks. We're gonna put it in on the right side. We're going to turn. We're going to apply on the next side. And I like to do a couple things here. There's a couple sort of key points here. Your face treatment is going to effectively be 3 areas. You're going to have your first area, your second area, your third area, right? And so when you lay down the product on area number 1, you're going to wait till it gets tacky. You're going to start your timer. Putting the product on area number 2 is going to take you another minute, okay? Another minute and 20 seconds, whatever that is, right? And so you want to be cognizant of the time that it takes to put down the product on the second area. And then similarly, you want to be cognizant of the time it takes to put it down on the third area. Why are you thinking about that? Because when you go to take it off, it's going to come off much quicker than it goes on, right? Because you gotta massage it, it's gotta get sticky, and then you're going to go to the next area. You're going to do the same. So maybe it takes me a minute, when I put it here, but when I wipe it off, it's going to be 30 seconds. Okay. And what you ultimately want is that every area gets the same amount of exposure time under the product. You don't want to put it down here. You start your 7-minute timer. It takes you another minute and a half to lay this down. But then when you clean it off, you just like clean off the whole face, because then this one gets 7 minutes. This guy's going to get, 5 minutes, and this is going to be like 3.5. Okay. So, so being cognizant of the time that it takes to put it, to put the product on that next sector. When you go to do the cleanup, you're going to clean off the forehead. It's going to take you 30 seconds. Wait a minute before you clean off here. And then when you're done cleaning here, wait another minute before you start to clean off here, so that everybody gets that full 7 minutes of exposure time, and you don't have a different exposure time on the different areas of the different treatment areas. But with that being said, again, you apply on the area, it becomes sticky. It's really sticky now. You apply on the area, it becomes sticky. You apply in the next area, it becomes sticky. You apply in the next area till it's sticky. You're going to wait till your timer, your buzzer goes off, and then now you're going to start your cleanup. So you're going to clean up first of all over here. And again, it's just going to be with a damp gauze, a damp sponge, right? Not wet. You don't want it dripping and running off and whatever. You just want to clean it up, nicely with it, just with a damp sponge. You'll do like one pass. It's going to be a lot of green on it. You're going to do another pass. It's going to be less, the third pass, right? Until it gets cleaned up, and then do the same and do the same. Pat everything dry once you're finished, and you'll be ready to move to your last step, which is going to be your rehydra, okay, and your relift. So it's going to be like one pump of the rehydra, put it on the hands, apply it to the area that you've treated, that you've done the peel on, and you're going to want to kind of massage this into the skin until it's absorbed. Okay. Relift, one pump, mix it up, put it on the skin, massage it in until it's absorbed. You don't want to leave the, the white streaks behind. You want to make sure it's going to get, kind of, it is going to get wiped in and it's going to get absorbed in nicely all over the different areas, that, just over the whole area that you've treated. Okay. But rehydra first, relift second, and then some SPF on top or whatever they're going to put before they walk out the door. But again, from lipogel to SPF shouldn't be more than 30 minutes. You're going to be 7 minutes on with the product with the BioRePeel on the face. You're going to be 5 minutes on with the carbon mask, and and you're going to be maybe a couple minutes dealing with the cleansing and the prep at the beginning. So that whole process shouldn't be more than 30 minutes in the chair from kind of start to finish. And the point is that you're doing the skin prep, you're doing the finishing products, and the patient doesn't need to be doing skin prep leading up to to coming in, and they're not necessarily going to need to do anything after the peel either, as a kind of a home care regimen. We do have, I mean, listen, we have these formats of the rehydra and the relift. We are going to suggest to you that you should have these and you should sell these to your patients, or if you're doing like a 4 treatment series for $1,000, you could give a couple of these to the patient, right? Let them take them home. You're going to be doing yourself a favor and you're going to be doing them a favor, because you're going to now do this treatment. You're going to spend the time. They're going to spend the money. The last thing you want is that they're going to go home and pull the whatever out from the cabinet and start putting that on the face, right? If for the few days after, if the skin is going to get dry, it's going to be tight. Rehydra is going to be the best product they could use for that case. Not because it's the best hydrating serum in the world. I don't know. It's the best hydrating serum to be used together with BioRePeel in the world. That's for sure. Like, this is the one that's been formulated to have the synergy with the product, no contraindication, to specifically address the type of nutrient starvation and dryness that's going to follow this peel, right? So again, like, these are not accidents. These are deliberately formulated in order to behave in a certain way with this product and address or counteract the dryness or the nutrient starvation that may follow the use of that product. And so again, an opportunity that you have to give or to sell these retail sizes to your patients. They're a revenue generator. They're doing you a favor that what they're putting on their face, and it's going to be again, kind of the best sort of formulation to work together with the peel. It's not mandated. It's kind of, again, just recommended, to be sure. But other than that, there's not going to be a specific aftercare regimen that must be followed in order to kind of generate or to maintain the the peel effectiveness. So with that being said, I think I guess I'll sort of turn it over. If we have if you guys have any questions, we've got sort of a few minutes left here to touch on anything else and answer some questions.
Aaron, so if the
Mhm.
peel, it shouldn't be, but if the peel is left on a bit longer than 7 minutes,
Uh-huh.
there's no damage really to the skin, right? It's just the chance of peeling increases.
Not even, and the peel self-neutralizes after 10 minutes anyways. So there isn't really concern that you could really leave it on for too long. It's but and yeah, there's no real risk of overexposure, I guess, is the answer to your question. So so you don't have to worry about that too much. Like, the 7 minutes is kind of that sweet spot that you get that good the good absorption, but without sort of overdoing it. But I've certainly never heard of a case like where it was left on and it had some kind of a a bad effect on the skin or something like that. Because again, after the 10 minutes, it's gonna be neutralized anyways. You wouldn't want to leave it on and send them out with it still on the face, but it doesn't like keep working after that period of time. So there's no risk of no real risk of overexposure in that sense. Okay. All right. Anybody
So
else? Okay.
if we're doing like a spot treatment with the gold, like if they've
Uh-huh.
got some stubborn pigment, would
Yep.
we apply it at the same time as we put the blue on, or do we do that after?
Yes. So what you're gonna do is you're gonna put the blue, let's say massage it in, right, until it's gonna be tacky. Then you're gonna draw like a half a mil of the gold and then go and put it on the spots where you want that gold and massage it in, right? So you put the blue first, you start your 7 minutes or whatever, and then you get your gold and you layer it in on top. So the gold's probably going to be on for like 5 minutes, not 7 minutes, right? But
Perfect.
but you'll be
Okay,
able to, you'll be able to first put the blue and then just put the gold only on those areas that you want, and then massage it in on top of the blue directly.
perfect. Thank you.
Okay, no problem. Um, all right. And and the other thing to keep in mind here, I mean, we can certainly wrap it up. And if you have any questions or you need anything at all, again, I always telling people that my work is not the sales job. My work comes after you buy the product, right? So, I'm going to be here to help you get support, service, ordering, quarterbacking, whatever you need done in the company, to give you direction, to point you to the resources, to find you the documentation. Like that's really what the work is for me, right? Is supporting you guys, so that you know how to use the product, so that you're comfortable, so that you have the tools that you need to go out and like to market and to sell and to practice and to use this product, because ultimately, your success in promoting and providing the service is our success in promoting and selling the products, right? And so from that perspective, our interest ultimately lies not in like selling you a box of blue peel, but having you be successful in continuing to use that and continuing to provide that to your clients, so that we have kind of long-term, substantive business relationship that over the time. So in any case, as I say, anything that you need, definitely don't hesitate to reach out. You know how to get a hold of me, and I'm going to be here to support you. Okay.
I have
So
one quick question.
yep.
It's if and it, you this probably was covered in the beginning. I just can't remember. So if I have a client that has a cystic acne,
Yep.
breakout, do we
Hmm.
avoid the pill on that area, or is it okay to apply it?
Um, you can apply the peel to that area. I would typically not leave it for quite as long. So maybe you do like sort of 3 to 5 minutes. Or if you see some frosting, okay, then you know kind of right away that you should just clean up that frosting and sort of stay away from that area. But as a general matter, you can still use the product in that case. Yes.
Got it. Thank you.
Okay. All right. So yeah, listen, thank you. We're like kind of right on time, 8:59, but thank you so much again for taking the time tonight, and I'm standing by to help if you need anything else. Okay?
Thank you for the info.
Not a problem. Thank you so much. Have a good night.